Thank you so much for the opportunity to present our work at Stanford Surgery Holman Research Day. This poster talks about the implementation of the ENTRUST platform for global undergraduate surgical education, curriculum integration at the University of Global Health Equity, UGHE, Rwanda. To ensure competency-based medical education globally, there is a need for accessible and evidence-based tools, especially in low and middle-income countries. ENTRUST, a case-based virtual patient simulation platform, was built exactly with this mission in mind, providing an equitable means for teaching and assessing clinical decision-making worldwide. This study in particular evaluates the methodology and outcomes of the longitudinal integration of ENTRUST into the surgical clerkship at UGHG. The diagram in the methods section showcases an example of what a patient in ENTRUST looks like, deliberately designed to be culturally appropriate. ENTRUST, in conjunction with the leadership at UGHG, was utilized to be integrated into the surgical clerkship curriculum, with a case library generated and usage planned for both learning and examination purposes. Students were queried after they used ENTRUST using a Qualtrics survey to assess their perceptions of ENTRUST and the system's usability. The platform was analyzed to gain utilization metrics, and correlation analyses using Spearman rank were conducted to understand ENTRUST's correlation with traditional gold standard assessment modalities such as OSCEs. The topmost diagram in the results section outlines a step-by-step reproducible methodology of integrating ENTRUST into clerkships. The boxes in red showcase the initial pilot with 18 students that enabled assessment of the usability and feasibility of the ENTRUST platform. Once that was successfully established, the green boxes showcase ENTRUST usage with 30 students for the case-based learning curriculum within the clerkship itself. This was done through the development of 8 cases. Examples include cases such as blunt abdominal injury and sigmoid volvulus. The blue and yellow boxes respectively showcase how ENTRUST was then used as a formative and summative assessment modality for the same 30 students for mid and end of clerkship assessments, as well as for high-stakes examination during the multidisciplinary medical school exit examination. The students who used ENTRUST in their clerkship were on average 24 years old, two-thirds were female, 86% spoke Kinyarwanda as their native language, and 96% were proficient in English. The system usability scale at the bottom of the results section showcased that students reported a good usability score of approximately 78 for ENTRUST. This surpasses commonly used educational and communication tools such as Microsoft Excel and Teams. Finally, in the results section, we can see that over the course of the year, an average of almost 18 cases were completed per student, with 3.5 hours spent learning on the platform. The performance outcomes for ENTRUST were comparable to that of OSCEs at 15.7 and 16.9 respectively, and when compared to traditional examination modalities, ENTRUST showed a positive and statistically significant correlation both at the end of clerkship examination and the medical school exit examination, providing validity evidence for its utility in examinations. In conclusion, our study not only demonstrated the feasibility of integrating ENTRUST into undergraduate surgical education, both for learning and for assessment, but also showcased strong usability, student engagement, student acceptance, and performance outcomes comparable to traditional examination modalities, demonstrating the potential for ENTRUST as a scalable and effective tool for competency-based surgical education worldwide. We are building on this success to integrate ENTRUST into OBGYN and internal medicine clerkships with specialty-specific case libraries and pilots already in effect. To further increase ease for faculty, ENTRUST is also leveraging AI technology to increase efficiency and reduce time and energy needed for case development. This addition will improve platform accessibility in resource-limited settings even further. Thank you so much.